Hey everybody, Dr. 𝙁𝙆𝙆𝘆 from Chiro Health Spa. Today we're talking about sciatica and what we could do here at Chiro Health Spa for sciatica. So let's talk a little bit about what sciatica is. So in real simple terms, there's a nerve that runs out of your back and goes down the back of your leg. So if you have any sort of back glute pain, back of the leg pain, going down into the calf, if the pain is running down into the back of the leg, that may be considered sciatica. So that sciatica is just an inflammation of the sciatic nerve. It's an irritation of the nerve, which can come from a lot of different places. But let me show you how we try to approach it first so you can see what we're doing. So the first thing that we're going to do is when you come into this office, that we're going to do a very full history to find out exactly what's gone on. Let's talk about that incident. Let's talk about maybe some prior incidents that you might have had. Then we're going to do a full examination. We're going to be looking at things like your range of motion, your muscle strength, your reflexes. We're going to see how tall you stand. We're going to look at an evaluation of your posture to find out exactly how far off of neutral you are, both front and back, and then from side to side as well. But then the other very important thing that we're going to do is take x-rays, and the x-rays are going to tell us a lot. So here's somebody with sciatica. So let me show you a little bit about how this works with a sciatic patient. So what you're looking at here, just so you can see, this is looking at somebody from the side. Okay, this is looking at them left to right side, and this is their back. So this is their left side, this is their right side. The green line that you see here is a normal neutral line, and the red line is actually where their bones are, okay? And this line right here is actually the level of their hips. So what we can see is this person has hips that are tilting down, but the spine is also going a little bit offline here, but where it's really going offline is here. There's a few things that we're looking at here, and again, here's a normal green line of to where these bones are supposed to be, and the red lines are that person's bones. So think about it this way. Those red lines should be sitting underneath that green line. We shouldn't even see them at all. But what we're looking at here is somebody that has real narrow disc spaces, and we also see that there's not a very good alignment here. Normally, these will line up in a nice smooth line, but you can see that the alignment isn't that good. It's almost like they're stair-stepped a little bit. Not surprisingly, this is where the sciatic nerve starts, in this area here, and it actually runs down back into your glute and down the back of the leg. So right here is where most people say, well, the pain is in the back of my leg, but we're all going to start here and look, well, where does it really start, and find out what those bones look like. We can see that there's some degeneration in here. We can see that overall the bones just don't look like they're in a very good position, okay? So we then take this information in conjunction with the exam and the history and the posture evaluation that we do, and then we put together a plan. And let's start the plan by first trying to figure out what we can do to get you better. And that's the very first thing is always, I want you to get out of pain. But the second thing, and the more important of that, is what do we do to set you up for the long term to be able to actually get you to not have this and be on a hamster wheel if this is happening over and over and over again. So the first thing we're going to do is we're actually going to do adjustments, okay? Chiropractic adjustments are geared very simply toward getting the bones to move into a more appropriate position and a very more comfortable position. And in this case, what we're going to do, actually, believe it or not, I actually do a lot of our adjustments standing. If you've been to a chiropractor before, you may not have had a standing adjustment, but what the idea is that somebody in that case, what that person has done has been to get away from the sciatic pain. They've gotten into a posture like this for a very long time. What I want to do is teach the body to come upright and be comfortable that way. So part of what we do with our adjustments is actually standing here. I'll actually bring you up against the wall and we'll push up here. And it's actually a lot lighter on you than you would think. It's much more comfortable for you. Now we take that and we also add to it a few different things. So some of the other things that we're going to do are, let's try to calm your muscle tension down. Clearly in a case like that, that's somebody that's had a lot of muscle tension because they just haven't felt good. So there's muscle spasm that goes with that. There's just a constant tightness that's happening. So one of the things that we're going to use is a therapy that we call electrical muscle stimulation. What we're going to do is we have it right here. We're going to put these two little pads on your back. And in general, what they're going to do is take that tight muscle and over time just kind of tire it out so eventually it gets fatigued. Now, that's going to work in the short term. Gradually, it can help work for the long term to just kind of teach your muscles what they're really supposed to be doing. But this is important just to kind of, let's say, put the fire out, I guess is the best way to do it. We just want to calm everything and get that tightness out of there that you feel. Now, in some more specific cases for sciatica, we find that the the disc pressure that's on there. So you saw in the x-ray that I showed you earlier, let's call the disc the shock absorber between the bones. They're supposed to be, let's say, this high. We find very commonly that in people that have sciatica, the disc might be this high. And as a result, it almost like starts pushing on the nerves that are going directly behind that disc, which will end up putting the inflammation down into the back. So one of the things that we use here is something called spinal decompression. So this decompression table is, the person will lay on this here. They'll lay with the head up here and the feet over here, and we'll put a belt around you here, right around your waist, and we're going to just attach it to here. And literally what it's going to do, it's just going to open up the disc space. It's going to open it up slowly and then close it. Open it and close it. Now, back years ago, they used to do traction, and they used to stay in the hospital for a week and a half or 2 weeks with weights at the end of their bed, and you would just kind of lay there and hope that that disc's pressure would start opening up. Well, this is a little bit more advanced way to do it now, and all it does is it very gently open, close, open, close. And we'll do that over the course of anywhere from about 8 to 10, maybe even 12 minutes. And that little sequence will then just gradually start. If there's a true disc issue that's causing the sciatica, this is one of the things that will be able to help that disc kind of work its way into just even that little bit of a better position, so that it takes just some of the pressure off of the nerve, and now gradually that pain starts working its way up into the glute and maybe back up into the back, which shows us that the irritation is getting a lot better, and we know that this is helping a lot. Now, in some other cases, sciatica is not necessarily coming fully from the back. It might actually be coming from inside the glute. There are muscles that are underneath your glute that literally lay right on top of that sciatic nerve. They're very deep, but a lot of times those muscles are just so tight that they're the ones that are putting the pressure on the sciatic nerve, and it doesn't have as much to do with the back. And that, generally we find, is more of a posture issue, okay? That's something that and especially nowadays, where people have been stuck sitting at home, they haven't been moving a lot, and over time, their muscles have just started to get tighter and tighter, because they sit in, you guys probably know, you might have done it yourself, you just sat at a computer for 3 and 4 and 5 hours and you realize, oh my God, I didn't even get up. What that does is it tightens up all the pelvic muscles and tightens up your core muscles, and gradually that muscle tightness puts more pressure on your sciatic nerve. That's another part of the evaluation that we're going to do to find out how much of it is actually involved with your back versus how much of it is actually involved with another group of muscles that's in your glute and underneath it. Now, the other biggest thing that comes with this, though, is that we have to always figure out, that's all fine and good to get rid of the pain, but what are we actually going to do to make sure that it stays that way, and that you're not on this hamster wheel and that it's continuing over and over again? So one of the things that we look at is your posture, okay? So again, for example, if we have somebody that's got a bad posture because they've been in pain and they've been doing this, we want to teach the body, hey, listen, you guys all have to eventually, when you feel better, learn how to do this so that ultimately you can meet in the middle. The most important thing that's going to come with being able to get over sciatica is strength. But I always say, you don't want to strengthen a bad structure, you want to strengthen a good structure. It's very hard to get stronger when you're in a lot of pain, but when you actually are starting to feel better, then we totally switch gears and start bringing in some other things to be able to teach your body what good posture is. So we use this thing right here, it's called the Den-roll table. We might look at your posture and say one of the reasons that you had sciatica was your posture was doing this for a very long period of time. If we can teach it to go this way, we'll ultimately learn how to meet in the middle, and now you have a stronger posture, not just for now, but also for the future. We're going to give you things to do both at home, we're going to give you things to do at here. That's why you see a lot of this very interesting equipment here. It's all geared toward changing posture and making things better for you, not only for the short term, but for the long term. Okay, I hope this helps. I look forward to seeing you here, and look for us on the next video as well. Take care.